So my name is Sol. We have Sarah Beth here, and we have Abu here as well. And we're all students. Oh, actually, graduated now from UCLA Fielding School of Public Health, and our expertise is within both community health sciences and environmental health sciences. Um, so before we first go into housing issues, especially in Los Angeles area, I want to talk about current events happening. First off with the pandemic, where countless Black folk are disproportionately affected, especially when looking at factors such as accessibility. So accessibility to medical facilities, to health insurance and paid sick leave, which may lead to, delay in seeking treatment. Also, when looking at higher risk for those who are facing public facing occupation, or those who have jobs that are considered essential services, who are unable to work from home. And the second pandemic is um, sort of police brutality on Black bodies. Um, and it's racism that people are protesting now. And racism is a structural determinant of both COVID-19 and police violence. But not only those two, events, but also maternal mortality and diabetes and hypertension and asthma, and also housing. So when we are fighting racism, this is an act of public health promotion. And Abu will talk a little bit more about social determinants in housing.
All right, thank you, Sol. So when we're looking at social determinants, we're really focusing on factors that are impacting a person's health and well-being. So I want to shift the conversation and kind of talk about the effect that housing has on health. And the three elements that I want to highlight are quality of housing, housing and commuting, and finally, social and emotional connections. So when we're talking about quality of housing, we're really looking at four different things. One, location of housing. So are you near highways or loud areas that can cause a lot of noise pollution? Two, do you have a lot of toxicity within the housing? So is there mold? Is there lead infestation? Roaches? That sort of toxicity. Three, looking at, do you feel safe within your house? Is there domestic violence? Is there aspects within your housing that just makes you feel unsafe based off of who is living in that home? And lastly, looking at the relationship between tenant and landlord. So for a lot of the presentations that you will be hearing, we talk about speculative practices, and this is a concern specifically mainly for lower and middle income folks whose landlords are either kicking them out or creating a hostile environment that eventually drives them out of housing. And so this really relates into housing and commuting, where when people live farther from their work, from their jobs, from their family, they are often left, sitting in the car for a really long time. And not only does that mean that they are not only does that mean that they are getting a lack of exercise and lack of physical activity, but they are also have an increase of stress, which ultimately results in high blood pressure. And another factor of long commutes is that social and emotional connection, which is lacking because the amount of time that is spent in a car means time lost with loved ones. And so all of these three elements are interrelated to the quality that your housing has on your overall health.
So for the purposes of our report, we decided to come up with a few next steps that community members and community organizers could take. to prioritize housing as a health issue. So the first being that community organizers can demand the use of what's known as a health impact assessment, or an HIA. Demand that an HIA be done before a project or policy is implemented. So HIAs are really useful public health tools that can be utilized before a housing development or before a housing policy is put into place, to assess the negative or positive health impacts that that development or housing will have on a community. So it could be used to support those initiatives that are beneficial to the community's health, or to deter those initiatives that might be harmful to community's health. And secondly, we recommend that both community organizers and community members become involved and support local community land trust in their work around sustainable housing. So you'll hear a little bit later in the presentation about the Tenants Opportunity to Purchase Act. And there's a number of local initiatives, both in LA and San Francisco, going around to organize around this initiative to give tenants more autonomy over their living space. And lastly, we recommend that both organizers and community members, and anyone who can vote, rally behind the fight to repeal the Costa-Hawkins law. So Costa-Hawkins was passed in 1995, and it limits the kinds of rent control policies that municipalities can have. And there's a ballot initiative coming up in California in November that would repeal Costa-Hawkins and allow cities to determine their own rent control policies. So we recommend that anyone who's interested in prioritizing housing as a health issue take these next 3 steps, or these 3 steps.
So we want to end with this quote by Samuel Stein, who's the author of Capital City Gentrification and Real Estate. Anything that you do that makes housing less secure makes health less secure. Thank you.